Hi friends, I am Dr. Pratap Singh. I have done MD in forensic medicine. In today's video, we'll continue with medical legal autopsy. In that, we'll discuss about external examination of the body. External examination is very much helpful in determining, detection of clarifying the issues, and this good description of surface injuries will be helpful to clear out any doubts regarding. And only doing external examination can be helpful for further internal examination. Coming to proper examination, first we discuss about the examination of clothes. Each cloth should be listed and examined and described with regard to type of garment, what type of garment it is, whether it is a cotton or any material of the clothes or external or in undergarments. Its color has to mention, its consistencies and size, manufacturer's label. This is again helpful if what type of cloth the person was wearing for his identity. Then if the laundry marks is present, then that where the cloth was washed can be uh, inquired about the case. If there are uniform, then uniform logos can be useful. If there is a tear, loss of buttons or disarrangement, which again indicates that there was a struggle, then there may some assault was there, something will be there, and each item found on the body should be removed from the body. Then clothing should be removed gently, taking care of to avoid contamination or loss of any trace evidences such as hair fibers, paint fragments, glass, sand, vegetable matter, etc. This all will be helpful in determining the scene of crime where the person was held or person was killed at the time of death. Again, these all materials should be collected, mentioning where the site was there, whether it was found on the near the collar or on the sleeve. That has to be mentioned, which should be sealed handed over to the police for further which will be helpful for further investigation. Then clothes should be removed carefully without any tearing to avoid any confusion of signs of struggle. It should be removed by unzipping and removing. If they cannot be removed intact, then it should be cut in the area away from any bullet holes or object along the seam in the garment. Usually the clothes should be removed as the person wears the cloth. If it is not possible, then it should be removed cut along the seams where the clothes are joined, avoiding any positive findings like if there is blood marks or stains are present, the cut has to be cut has to avoid. If there are tears or if there are injuries are present, then that part has to be avoided and cut along the seam lines if possible. Then clothes are examined for cuts, holes or blackening from firearm discharges and compared with the injuries of the body. Then whatever the cloth injuries, if there is a cloth injuries present here and underlying that there should be a corresponding injury should be present. If there is a hole is present, then underlying there the injury should be present. If there are mismatches present, that indicates that the cloth was changed, so that is also possibility will be present. Then any blood stains, seminal stains, grease stains, etc. should be described, and if they are possible has to be taken. Stains due to poisons may include like vomit should be kept for analysis. If there is any stains regarding vomit, if found on the cloth, should be examined and should be kept for analysis. If wet clothing is there, it should be hung up to dry but should not be heat dried. So the clothes should just be sun dried, should not ever be heat dried. Then packing of wet clothes may promote growth of fungus, hence the growth should be dried. Stained and unstained areas of the clothes should not be allowed to come in contact to avoid additional swelling. So always the part of the cloth which is stained should be kept aside and dried before packing and sent. The clothes should be placed in a clean plastic bags or other suitable clean containers. The clothes description should be mentioned in PM report. All the description, all the cloth articles, any positive injuries present in the clothes should be clearly mentioned. They should be handed over to the police in sealed packet if not sent for FSL. So if there are any stains are present or tears are present, then it should be sent for FSL for further analysis. If there are no stains or if there are no any findings which is suitable, which is required for investigation, then they are sent to police for further investigation. Then if there are any ornaments are present, they should be removed. Each ornament should describe a type of ornament, design of the ornament, color of the each ornament should be described like yellow or white, white metallic, white red, green stones, etc. So each ornament like necklace is present or bracelet is present, all the articles should be removed and handed over to the police and relatives. Next, coming to examination of body proper. After removing the clothes, then you have to look general examination of body should be done. First, nail scraping should be taken with the help of a folded paper or some blunt matchsticks. And what are the item the like a soil, sometimes there may be soil article, soils may be present, sometimes epithelial tissues may be present where the person may try to have scratched the victim, where should be there. So each scraping should be placed in envelopes, in separate envelopes for each fingers, like so 10 envelopes should be prepared for each finger, and whatever the items are, whatever the debris obtained from the nail scraping has to be placed. Any visible fibers or any matters in the hand or adherent to it should be removed and placed in envelopes. So anything the person is holding in the hand. So if the person is holding any materials should be handed. If the because of rigor, so if because of rigor, if it is not possible to open, the sometimes the muscles may be incised so that the hand can be opened to remove the items held by the hand. Next, vaginal anal swabs are taken mainly in cases of sexual assault. Pubic hair should be combed thoroughly. Metapubic hair, if there should be cut with scissors and samples of the pubic hair taken. So this is mainly applicable in cases of suspected sexual assault or cases of anything. If there is there, then suspicion is there, then usually pubic hair, any loose hairs found on the body should be also be collected and preserved. Next, height and weight of the body is taken, and general state of the body build, whether the person is well built, fatty, development, and nourishment has to be taken. Then general coloration of the skin is noted, presence of any rash, petechiae, which is one of the sign of asphyxia, should be looked for. Color of the body, if there is any cyanosis or uh, changes in the skin color has to be there. Then looseness or turgor of the skin should be noted. Mainly the skin becomes toughened in case of putrefaction or loosened in cases of drowning, the body may become loosened. Asymmetry of any part of the body or muscle wasting if present should be noted. Then bodies should be described in general, including like what is the stature of the person, what is the sex of the person, age, generalized age, what is their color of the skin, race to which the person may belong, build of the person, it is well built, normal built, medium or not well built, then deformities present in the limbs, nutrition, he is well nourished or malnourished, then hairs, if there are hairs are present or not, if there are scar tissues if present has to be mentioned, tattoo marks if present has to be mentioned with the type of design, what is the tattoo marks is there. Again, this is helpful in case for identity of the person. Again, if there is any moles, pupils changes, skin diseases, circumcision, amputations or deformities, anything which is unique to that person has to be mentioned in the PM report, for it is mainly useful for identification of the person for that purpose. Then presence of stains on the skin from blood, mud, vomit, feces, then corrosive or other poisons has to be mentioned. Again, cases like vomit is present may be found in the skin, on the face, feces may be there because of defecation may be there, because in case of hanging the person usually ejaculate or urinate and defecate. Then corrosives in poison cases, there may be changes in the mouth, there may be corrosions in the mouth, there may be corrosion in the lips, there may be there, that has to there. Then if there is a gunpowder residue is present, it should be noted. Usually in cases of fingers, if the person has fired, or in case of, then there may be deposition of burnt gunpowder may be found on the hand. Then presence of signs of disease are looked for, like edema of the legs area or some dropsy is present, or signs of dropsy is present has to be noted. This is to mainly to rule out any natural causes of death. So sometimes unknown dead bodies arrives in the hospitals, and it should has to, every unknown dead body has to be examined, and if there are signs of disease are present, then it will rule out unnatural causes. Mainly natural causes will be presumed and the autopsy is carried out. Then head hair should be examined for again any foreign hairs. Then samples of both cut and pulled hairs from the least 6 different parts of their scalp should be taken and labeled as to their origin. Any loose hairs found on the body has to be preserved. All the loose hairs, usually in the up to 10 places has to be preserved. The face should be examined for frothy fluid at the mouth and nose. Cyanosis, petechial hemorrhages and pallor should also be looked for. Mainly in case of asphyxial deaths, there will be presence of petechial hemorrhages and cyanosis. Then froth from nose and mouth usually seen in cases of poisoning, nose and froth is present. Then pallor if there is present, mainly if the person has died because of hemorrhagic shock or internal bleeding or external bleeding. In these cases, the person the face will look pallor. Then eyes should be examined for presence of condition of the eyelids, conjunctiva, sclera, opacity of the cornea and lens, color of the pupils, artificial eyes if present, contact lenses if present, petechials is present, or bleeding if in the eyes present. This all indicates any abnormalities. Contact lens is helpful for identification of the person. Then any changes in the conjunctiva, sclera, opacity may indicate that there may be fractures in the skull that will be present. Then ear should be examined for leakage of the blood in sieves. Again, it is helpful in case of skull fracture or brain damage. There is chance that some blood may be leaking from the blood from the ears. The neck must be examined for presence of bruises, fingernail abrasions. This is mainly case of the person is throttling is done where the person's hand is used to compress the neck. In that case, there will be fingernail abrasions will be present. The ligature mark if present or any abnormality is present, that presence for hanging is looked for. Then thyroid is examined for size and nodularity. Lymph nodes is for in case for mainly in cervical, axillary, in inguinal, thorax if there is symmetry or general outline. Again, these are all looked for mainly to rule out any diseases and natural causes. If there is any presence of natural causes explaining the death. Then breast is also examined for size and masses if it is present. In abdomen, presence or absence of distension or retraction or stria gravidarum, which is indications of pregnancy. So if the woman is if there is a woman case, then stria gravidarum is looked for and changes in the breast is looked for to rule out pregnancy. And if there is pregnancy is present, then uterus dissection has to be done. Then chances may be there present, then fetus may be detected. Then back is examined for presence of bed sores or spinal deformity. Then external genitalia is examined for gender development, edema, local infections, position of testes for mainly in case of males. Then it's examined mainly for development defects. Then natural orifices mainly is examined like mouth, nostrils, ears, vagina, mainly in case of vagina for sexual assault cases, mouth, nostril, ear cases mainly for concealed wounds. So there are chances that concealed wounds may be present where in this mouth, nose and nostrils some pointed object may be pushed inside to injure the brain leading to death. They mainly look for a presence of injuries, foreign matters, blood. The state of the lips, gums and teeth, marks of the corrosions and injuries to the inside of the lips and cheeks should be noted. This again is helpful in cases like smothering where on the externally there may not be any contusion present, but internally in the lip there may be lip may be contused. Sometimes there may be tearing of the frenulum may be also noted. Then mouth is examined. Mouth is smelled for any alcohol or phenolic smell is present. This is mainly present in case of poisoning. Mainly it may not be in the history, but if there is a smell of alcohol or smell of phenol is present, that indicates the person may have consumed the poison, but may not be seen outside externally may not be present. So kerosene like smell is present in case like OP poisoning. See that will be noted. Then note the position of the limbs, particularly the arms, hands and fingers should be noted. The hands should be examined for any injuries, defense wounds, electric marks, etc. Defense wounds are mainly if the person in the mainly seen in the forearms. Maybe when the person try to defend it will say. Then if there is any edema, needle marks, ulcers, gangrene, tumors, digital clubbing, etc. is noted. Then needle puncture marks, if it is present in the arms, buttocks, etc., should be looked for in mainly in cases of drug addicts. The he will try to conceal the needle marks, puncture wounds near some places where it is inaccessible, like arms, buttocks, etc. Mainly in drug addicts, or overdosage may lead to death. Then external wounds has to be examined and thoroughly, and all the injuries has to be listed or numbered. So mainly injuries has to be listed on mainly. Then also in cases many numbers injury number should be numbered so that all the injuries can be remembered properly. So each injury should be description of wound should be done properly. which includes nature of the injury, like whether there are abrasion, contusion, or laceration, that is type of injury, then or incised wound or those. Then site of injury, where it is located. For example, if there is an injury on the leg, like there is a grace abrasions are present on the body, like first there we have to describe what type of injury is, like there is abrasion on the uh, right thigh is present, then site will be in the right thigh, about me in the mid one third, length, how much is the length, so we have to describe it, length how much it is present, then breadth how much the breadth is present, and depth mainly in case of stab injury or perforated wound has to be there. Then direction, so sometimes direction can be detected in cases of incised wound, the direction can be noted. So in graze abrasions also, if there are multiple graze abrasions are present, sometimes in cases of brush burns that grazes, that we can detect the direction. For example, if there are thickened injuries are present, then direction can be presumed. Then position of the injury, where there presents margins, whether margins are clean cut or blunt. So if there is clean cut, it indicates the sharp weapon was used. If the margins are ragged, then it indicates that blunt weapon was there. Then examine the base or extremities should be there. Then each injury should be mentioned from the distance from the mid any anatomical landmark. For example, in the thighs, the landmark will be from the knees. From the knees, how much the distance it is present will be there. In the abdomen, it can take the midline, how much distance it is present, and how much distance it is present from the head, or and from how much distance it is present from the toe is also helpful in cases of regional injuries. The condition of the edges, presence of fallen body, coagulated blood, and evidence of bleeding into nearby tissue also noted. So each injury edges has to be clearly noted. So if there is clean cut as in this diagram, it indicates it is a sharp weapon. If the edges are ragged, sometimes it may be there, then indicates that it is a blunt weapon injuries. Then if there is in injuries, if there are any foreign materials are present, like ragged injuries are present, sometimes some stone particles may be present. In that cases, that foreign material has to be collected, and each injury has, whether the antemortem or postmortem should be determined. So mainly it can be determined by presence of vital reaction, or sometimes based on the whatever bleeding is present, then external bleeding whatever is there, that can be helpful. Then foreign materials like hair, grease, fibers, etc. that may be present in the wound has to be collected. If there are any hair fibers are present or stored particles are present, that has to be removed. If the injuries are obscured by hair, as in scalp, the area should be shaved. Deep or penetrating wounds should not be probed until the body is opened. So if there is a stab wound is present, mainly if there is a single edge weapon, if the stab wound is present and it goes deep into the body, it should not be probed till the body is opened to know the depth. In burns cases, their characters, position, extent, and degree of should be mentioned. So if the person's body is burnt, then each burn how much percentage, based on rule of 9, we have to calculate the number, how much percentage the burn is there, character of the each burns, whether it is single, first degree, second degree, third degree, position, extent, and degrees, how much degree is present, whether the first degree or second degree or third degree burns are present, has to be mentioned. Then use of printed body sketches is very helpful. Every body in each PM report, a body part has to be there, and wherever the injury is present, if there is a burn mark is present, that has to be diagrammed. If there is a stab wound is present, that has to be diagrammed. If there is a abrasions are present, that is also diagram should be noted. And if there is it is very helpful in cases like firearm injuries is present, that is also helpful. Each injury can be drawn in and measurements noted alongside each and distance from anatomical landmarks recorded. So each injury's distance from the anatomical landmark should be recorded. Injury should be numbered and related to written notes. Photographs are also helpful in recording the injuries. If the blood spots or smears on the skins are very important areas, should be photographed before and after the skin is clean. Excluding stab and firearm wounds, all the injuries should be divided into two broad areas of external injuries and internal injuries. Externally, how they look, and internally, how they look has to be mentioned. Continuing body examination, the limbs and other parts should be examined for fractures, dislocations by sutural movements and by palpations, and confirmed by dissection. So if there is suspicion of fracture is present, then the movement of the body should be done to rule out that fracture was present or not. Then time since death has to be calculated roughly based on the rectal temperature, which is helpful, mainly degree of how much temperature decreases by time. Then rigor mortis, which usually starts by 12 hours, present at 12 hours and pass out to 12 hours. Then postmortem hypothesis, which sets about 6 hours after death, and putrefaction mainly takes about 12 to 24 hours to complete starts appearing. So based on different criteria, postmortem time since death has to be calculated. Made of all articles removed from the body like clothes, jewelries, bullets, etc. They should be labeled, mentioned in the report, and handed over to the police in the sealed cover after opening the receipt. The report should be include all the surgical procedures, applied dressings, other diagnostic and therapeutic measures found on the external examination. So sometimes some therapeutic procedures may be done, like drainage holes may be present on the body, sutures, injuries may be sutured, so that has to be first examined. So if there is an injury, if this suture marks is present, that suture marks is removed to examine the injury properly. Then again, then those has to be clearly mentioned that it was a sutured wound, and it cannot be determined whether it was sharp or blunt. So once the suturing is done, it is very difficult to determine whether that injury was sharp or blunt. So anything based on the case report, we have to find whether that injury was is surgical procedure normal. Then coming to skin incision, after the complete external examination, we'll start the skin incision to it is done. There are mainly three types of skin incision: I-shaped, Y-shaped, and modified Y-shaped. The incision must be adapted according to the special conditions of the cases, like in stab wounds of the chest and abdomen. The usual incision may not be altered to avoid such wounds. So based on what the criteria, whatever the situation is there, that type of incision has to be taken. Come to first is I-shaped incision. The I-shaped incision extends from the chin of the person. It start from the skin straight down to the symphysis pubis and avoiding the umbilicus. So if you presume that umbilicus is present here, then incision starts from the chin to suprasternal notch to supisternum and avoid the umbilicus and till the symphysis pubis. So umbilicus is avoided because there is a dense fiber tissue and it's very difficult to reconstruct the body. So once the incision is taken, it is very difficult to reconstruct. So if umbilicus is teared apart, so because of that, usually the incision is taken avoiding the umbilicus. It is the most common followed method. So usually this is the incision is taken from the chin till the symphysis pubis, avoiding the umbilicus. This is the one incision which is taken always, most of the times. Then Y-shaped incision. The straight line of Y corresponds to the xiphisternum to pubic symphysis. So from the xiphisternum, so avoiding the umbilicus. So first injury, the first incision is taken along the from the xiphisternum to from the symphysis pubis. The first this is the incision is taken. Then forks of the Y runs down below the breast and extend towards the acromion process. So if there are breasts are present, then then in Y-shaped incision the extends from both the sides and goes towards the acromion process. So this is the incision, this is the Y-shaped incision, where it starts from xiphisternum to the symphysis pubis and from xiphisternum towards the acromion process, avoiding the breast. Disabling, where it is customary to keep a dressed body for weaving or sometimes after that. It is mainly required in cases like female cases. It is usually considered where the the part is preserved where it is required and only the part is incised. So mainly the incision starts from xiphisternum to symphysis pubis, from xiphisternum to acromion process the incision starts. Then in modified Y-shaped incision, an incision is made in the midline from suprasternal notch to symphysis pubis. So in this case, again the incision starts from the suprasternal notch avoids the umbilicus and goes to the symphysis pubis. From suprasternal notch, it goes along the clavicle and goes towards the back. So initially extends from the suprasternal notch over the clavicle to its center on both sides, and then passes upwards over the neck behind the ears. So this is the incision where it starts from suprasternal notch, goes to the symphysis pubis avoiding umbilicus, then from there to the clavicle to the back of the neck. It is mainly used in case of detailed study of the neck organs. In cases of hanging and strangulation, this incision is helpful. So after taking the incision, the internal examination is started. In next continuing video, we will discuss about the opening of the body after taking the incision. These are my references. Thank you.